All right, we're back. We wanted to add an addendum in regards to what we had just left off on. We wanted to touch down on some additional tips and tricks on the product, profiling the patient, get a little bit more knowledge from Ted. Ted, go ahead.
So we just talked about really pretty regular patients going in the brace, but we're being presented more and more with obese patients. And so what we have here is large thighs, let's just tell it like it is, and a conical shape to those. Typically a surgeon will not want to brace that patient because they can smell a failure. These patients never in the past have done well in any kind of brace. And so what I did was kind of worked out from the design of the ADJ, Select ADJ, to a modified version, and I have to thank my good friend Arnie at Oser for helping me with this. But you can see we have a two-piece thigh shell. It helps that this is pink too, so you can see this really well. Okay, and that's in fact split in half. Now, if the brace is sitting on the patient right now, and as you know, all braces settle, you can see that the straps move, but this lateral or medial, in whichever case, component, separate section, stays in place. And same thing works here. So this keeps the tension on the upper shells that help deliver the force across the knee. And this has captured a lot of patients. Now, you have to have a good chat with your patient. You have to let them know this is going to be tight and this is going to be uncomfortable, at least at first, but then perhaps you can relate that to, the first time you you wore high heel shoes, for instance, and of course only the ladies know that for the most part, but
you never know.
You never know. And so, but this is in fact the deal. So we put it on, we apply all the forces. I fit patients in this brace close to 400 pounds and got pretty much the same results as we get with the regular Select ADJ on normal patients, or somewhat normal patients. So this has been a very good key for us. In other comments about the unloader one, finding it to be a very competent brace. I actually wear one myself on occasion, and I'm 5'11", at least I was, and at one time I was like almost, I was 290, now 65 pounds down. But nevertheless, I was wearing this for doing yard work and things like this. My knee was a whole lot more comfortable just with the unloading that it could do. But in general, if we're basing our reputation upon our next patient they're going to send and the next brace that I can fit, I really get a lot of lack of unloading just from the extra flexibility. So if I put an action across a brace and my reaction comes this way, I don't get as much unloading as I do with a stiffer orthosis like the Select ADJ. This one I'll use with smaller patients, more trim legs, and less of a deformity, and you can note that from chart notes or visualization of the patient. Yeah.
Perfect. Well, again, I appreciate all this information. You're a legend. I appreciate your time.
Legend. All right, I'll do that. Yeah, put that on my card.
I will.
Legend.
Thank you guys for your time.